Welcome to the Opioid Settlement Advisory Board. It is October 19th, 2023, 4 p.m., and we call the meeting to order. We are aware two of our members, Barry Allen and Adria Johnson, is absent today. For the record, this meeting is live streamed and it is being recorded. I think we have all become experts in virtual meetings, but keep yourself muted till you are speaking in the meeting. So my name is Inder Singhal. I'm the interim medical director, and my co-chair, Connie Mendel, who is the interim chief health strategist. Let's start the meeting by a brief introduction for all the board members. Let's start with Ms. Barzin, and then we'll go around.
Hi, Mariana Barzin. I'm Executive Director of Office of Philanthropy in the Office of the Mayor.
Mr. Zimmerman.
Yes, I'm Lee Zimmerman, and I am the CEO of the Kids Club, which is a healthcare facility for medically complex children in a daycare type setting. I also have lots of hands-on experience with opioids and really pretty much all of the possibilities that come from the use of such opioids.
Deputy Mayor.
Nicole George. I work with our public health, public service agencies. And my background is in child welfare.
Connie.
Hi, Connie Mendel. As Dr. Singhal mentioned, serving as the interim health chief strategist for Louisville Metro Public Health and Wellness. I just celebrated my 26th year with the department. I started out with our environmental health programs and moved through operations and into the director position. So thank you everyone for joining us. Dr. Singhal?
Just a little background for reference. Louisville Metro reached a $57 million agreement with manufacturers and distributors who fueled the opioid epidemic in all over the country. City will receive these funds over 18 years. For 2023, we were awarded $7 million, and the first round was solely focused on saving lives and harm reduction. And after due diligence, we have awarded close to $1.7 million to certain community partners, and Taylor will go over that in just a moment. For our second round, our focus is to prevent future substance abuse. We'll focus on promoting long-term recovery by increasing the number of people who are in treatment and also retaining them in treatment plans and making sure they continue to receive treatments. We'll also focus on comprehensive wraparound services for people who are experiencing homelessness and to support their treatment and recovery. The purpose of this board is to help the mayor and Louisville Metro in selecting partners who align with our priorities. I see that Councilman Baker just joined us. I'm going to pause for a minute so he can introduce himself.
Hello, sorry for my lateness. Me and Deputy Mayor George just left a Parks and Sustainability Committee, so sorry for that. But thank you for having me. I'm Councilman Baker. I represent District 6, and so I look forward to making sure I'm engaged as a Metro participant in this process. So I'll turn it back over to you, Inder, and good seeing you again, Inder.
Thank you. Yeah, thank you. Good to see you. I'm going to ask Connie and Taylor to take over so they can give us a little bit of an update on the first round of awards and where we are in the process. And also, Connie will go over how this advisory board will be structured and how will we go about trying to award the next round of select the next round of community partners.
Okay. So I can go ahead and give that information first and then turn it over to Taylor to talk about what was phase one. So yeah, just to share our mission, and that is to increase opportunities for everyone to live their healthiest life, reach their full human potential by investing in evidence-based solutions for substance use prevention and addressing the needs of the people who experience the greatest barriers to accessing harm reduction, treatment, and recovery services. So our guiding principles all along have been to spend the funds towards saving lives, using evidence to guide spending, invest in youth prevention, focus on racial equity, and align local funding with state funding allocations to maximize and private dollars for optimal impact. So our activities will be to develop a fair and transparent process for deciding where to spend this funding, develop priorities and goals for spending on projects and programs, provide recommendations to Louisville Metro government, decision makers on how to best use these funds from the opioid settlements, to report on project and programs related to addressing the epidemic, and create and maintain a website on which it will publish these board meeting minutes, attendance rolls, funding awards, and the reports of the funding by the recipients. So that gives you a little bit of background information. The meetings will be conducted according to KRS 61.800 to 61.850. We'll meet at least twice within the calendar year, which is part of that KRS. We'll meet many more times within a calendar year. And each member shall have one vote, with all actions being taken by an affirmative vote of the majority of the members present. So with that, I'll go ahead and turn it over to Taylor Ingram, Louisville Metro Public Health and Wellness Chief of Staff, to go over what was phase one of spending.
Yeah, thanks, Connie, for that introduction, and good afternoon to the board members. I help support the co-chairs in this work, along with some of the other great public health and wellness staff that are on this call this afternoon. So I'll be talking through attachment 2 that was in your pre-work. This is a high-level overview of each of the projects funded through the first round of allocations that the city approved. I will say we learned a lot in this process. This is the first time that we've undergone this, so that will hopefully help inform the board's efforts moving forward to continue to refine and enhance this process. There were 3 community-based organizations that received funding. 2 of those we are still working with to finalize the grant agreements needed to be able to distribute funds. And 1 of the organizations, that agreement has been completely finalized, and we are working to get them their first official award. The work that's happening under the health department's umbrella, we've been able to move forward on a little bit more quickly since we already have some of those systems in place. So happy to share that the work to expand access to free naloxone and overdose prevention education has started. We've been able to purchase 600 units of Narcan, and already over 280 of those have been distributed in the community. The other 2 items I'll mention just really briefly. One of the mandates that we had provided was to contract with an external evaluator to help us assess the impact that these funds are having and be able to share that back with the community. That contract with the University of Louisville School of Public Health and Information Sciences is complete, and Dr. Jovita is on board, and we'll get to talk with her a little bit later in the meeting. We are also hiring a dedicated staff position to help support this work and provide great customer service to those in the community who are interested in learning more about the award and during the application process. That position recently closed. We had 13 applicants, and interviews for that started this morning. So happy to stop there. The full details are in your packet, and if you have any questions, I'm happy to answer them in this space or discuss with you offline.
Dr.
Great.
Murillo. Hello?
Hi.
Great. There you go.
Hi. If you like, please say a few words.
Oh, yeah. So my name is Dr. Jovita Murillo, and I have I'm a former social worker, right? And most of my cases were in substance use, and then I ended up getting a PhD in public health. I have experience working in Department of Public Health in California. And our way of addressing opioid use was using a community-based model. So we were able to get into the universities, we were able to get into the schools, we were able to get providers to work with us. And again, it took a lot, right, for us to be able to implement a community-based approach to addressing opioids. I am an evaluator and I do have questions. So I don't know when my time is, I don't know if this is the time for me to start asking questions now. So I guess my first question is, what are you hoping to gain from the evaluation? I ended up seeing pretty much the requirements or what ended up being part of the settlement. Um, and there's a lot of components to the settlement. And so I want to know exactly what is it that you want to get from the evaluation? What are you hoping to focus more on? And if any of y'all can speak on that.
Thank you. That's such a good question. Actually, that is one of the two asks of the board. One of the first asks is for the first round, even though a lot of us were not involved in the process, the ask for the board from the board is, let's figure out what should we be evaluating so that we know we partner with the right community partners and we're serving our community to the best of our ability. So we will be discussing that. So you brought that up. That's great. And the second ask of this board, welcome, Dr. Lederman. Thank you for joining us. And the second ask is for the second round. Our ask for the board will be not only to help bring awareness to the right community partners who will help us with focusing on prevention and treatment and help us select community partners. So to answer your question, I'm opening the floor. I think it's a good point of discussion. What KPIs should we be measuring? What should we be looking for as a board? So we know we partner with the correct community partners. And remember, our focus for the first round was harm reduction and saving lives. Any,
I guess anybody can jump in.
please.
Okay. I was waiting to be called on. So, but one of the things is, I think you're absolutely right. I think I think we need to be looking at making sure that we're getting partners who are actually doing the work. You know, when we come together and say this is what our intent is that we're doing. But the second thing I think we should consider is too, and I hear it from the council side, in particular my district where I have like the Healing Place and New Legacy and all these type of things, making sure that from a diversity, equity, inclusion of partners, the people who are actually on the ground doing the work actually are supporting the way where they can do the work. And so those are probably two of the biggest things for making sure that we're using partners who actually are equipped and can administer the work. And two, that we're partnering with people who are, are the full gamut and represent all populations. And so that's my 2 cents. I'll open it for someone else.
Councilman Baker, I totally agree with you. We know even though the opioid overdose deaths, related deaths are decreasing, we know they're significantly higher among African American communities. So when the team was trying to select community partners, I think they were well aware of those facts and have kept that in mind. But keeping that in mind, as you said, even though we selected those community partners, can we give Dr. Murillo certain measurable parameters that she could be looking for? And I think that's what will make us all happy that we're doing the right thing and that we can present to council when we are going for the second or the third or the fourth round. Anyone else?
Yes.
Deputy Mayor?
I'll defer to Lee.
Okay, thank you. Yeah, and looking through this subject and talking with some people that I respect in the community that have been dealing with opioid abuse, you know, it appears to me that there are a couple different avenues or lanes that I think should be considered. And, you know, first of all, are the basic needs of shelter, food, and clothing. And so, you know, to send someone through treatment and not have answered those questions or those basic needs, I think is going to be very difficult and fairly unsuccessful in you know, in the numbers of successful cases. So I think that needs to be looked at. You know, I've also talked with people that are in the in the in the business of being psychologists, addicts that are working as counselors, etc. And you know, I seem to come up with two different schools, and one of which is the medication assisted treatment. You know, Suboxone, Vivitrol, etc. And you've got that school. Then you've got the other school, which is abstinence-based treatment. And you know, I have to say that I'm kind of a generalist. That I believe that it's not. It doesn't need to be either or. I think that this is such a huge problem that the more avenues we have for successful treatment, successful impact on actively using addicts, the better we are. I mean, if the if the medication, Suboxone, etc., works for some people, and that is the only thing that they've been successful at staying away from the illegal aspects of addiction and staying away from the dangers of, you know, what's prevalent in our market now is fentanyl. Then, you know, that's one area I think is very important. There are a lot of people in this community that have been working on abstinence-based treatment for their careers, and you know, that was my choice, was to go to abstinence-based, which I am really glad that I did, and that was many, many years ago. But the fact of the matter is, in reality, not everybody's successful at that, and I think we should consider being kind of a catch basin for those that come out of abstinence based with you know, without the success, and they just go right back into the um, you know, into the jungle, if you will. And so those are a couple of the things that, you know, I think are important from my viewpoint of some of the areas that we need to consider helping fund. And but I think that first thing that I talked about, which were your basic needs of shelter, food, and clothing, always has to be somewhere in, you know, in that same view.
Thank you, Mr. Zimmerman. And actually, both Deputy Mayor and the Mayor strongly agree with you when it comes to shelter and food and clothing. Deputy Mayor, you had a comment.
Yes, Chair, thank you. I would say a couple of things. One, I'm really interested to see impactful measures that move beyond just outputs. So I think it's really important that we talk about how much Narcan we distribute. I think that's tremendous and certainly a measure of success. But I'm interested to know, are we seeing fewer people die from overdoses? I'm interested to know, are we enhancing connections in an underserved area and with populations that we would not normally be touching? I'm interested to know if more community has access to treatment. Is there less recidivism in our system? So everything from jail and hospitalizations to foster care. On the prevention side, doctor, I don't know how to measure prevention, and I would venture to say it's probably the most challenging of the categories. But I think being able to look at a minimum an array of child well-being measures, so everything from the health of maternal health, in addition to family preservation, and even maybe early childhood education. And I'll leave that to Mariana. But I think being able to think about, and again, it's probably the most difficult, but are we having an impact on prevention? And I'm going to say this, and this is not going to be popular. And trust me, I did not build a career on helping others to say this, but I'm going to say it anyway because I have learned it is super important. And Councilman Baker can back me up on this. Uh, Council members are going to want to see a return on investment, particularly even though we all know these are settlement dollars, these aren't, they do come through the public. And if we want to make the case that by doing this, we are saving the system, we need to demonstrate return on investment. And I hate that I have to say things like that, but Councilman, I remember Councilman
A
McCraney.
fiscal return of
remember-
investment. Yeah.
she was very clear. So, and I know that pressure. So, okay, I'm going to put these questions in the chat. I'm sure everyone has lots of them.
Dr. Mayor, I 100% agree. And on your comment, return on investment, I think it's even more important to be conscientious when you're in public service or in nonprofit. Return on investment is important. Doesn't mean in financial terms, but what are we achieving? Dr. Liederman, I know you joined late. I think it would be great if you could just give 1 minute intro. I know you were stuck in traffic, and then any comments. Okay. Dr. Murillo, I think Dr. Liederman is at a place where she is not able to talk. What other questions do you have for us?
Next question is, so what limitations or maybe challenges do you foresee as we move on with this settlement funding, right? Is there anything that maybe I should be made aware of in terms of challenges, limitations?
Connie, any anything that you can share?
Well, I mean, this is, I guess, a good opportunity for us to talk about. We will be soon making a call for proposals and projects. We are planning on doing that in the next 30 days. So I get for this group and for you, Dr. Merlot is looking at reviewing all of these applications. We do have a template that was shared in not this last communication, but the prior communication for the board members. It basically an application template. So one, reviewing all of those, determining which of the projects are feasible. I am expecting a lot of interest and competition for these. Sustainability is one of the things that come to mind. We do have this funding. The initial amounts that we're able to disperse are larger, but as it stretches out through 18 years, or I guess now 16 years remaining. So for the projects that we fund, we would, my goal would be to see sustainable projects. Certainly those that are evidence-based. Um, and so that's a lot of work for this board. Thank you all for volunteering to be part of this, and for Dr. Merlo and the LMPHW team.
And I,
Bonnie, what I'm wondering is,
Sure.
and this is like a very small challenge that I don't know is really in the spirit of what we're talking about, but it does come to mind. What are the challenges associated with finalizing the awards? If we awarded 3 in the first part of August, I can't, I have no idea the time frame. And obviously it's taken so much time and we're still working to finalize the 2. Like, what are we learning about that process so that we are able to execute, dollars more quickly?
Yeah, so we have identified obstacles on both sides. For us internally, we are part of the greater Louisville Metro government system. So, the finalists, this board and the proposals will go forward to Metro Council. So from there, once approved, that those entities will then go into our Office of Management and Budget system. And then there is work on the side of those that are awarded, providing a specific documentation. So typically, it would be probably 3 weeks for once them to be into the Metro government, the procurement system. And then there are several documents. So what we've learned from phase 1 is that we are going to outline specific deadlines for the recipients to have all of their information in place, and all of the paperwork and those sort of things. As Taylor mentioned earlier, it was a little easier for us to get up and going and spending because we already have the infrastructure in place. So, and also as we bring on this new staff person to help and assist, these organizations with getting all the right paperwork turned in, getting the forms and invoices in. So, yeah, we have certainly learned from phase 1. Did that answer the majority of your question? Okay.
one comment I have about what Connie said, sustainability. I think is extremely crucial. As we said, the money each year decreases. So the first year was 7 millions, but if you can imagine, $54 million looks like a lot of money, is not. And it decreases each year. So I think we should be very careful in selecting our partners now so that if they're doing good work, then it's far less money wasted because they will be able to sustain their work by more funding down the road versus keep on selecting newer partners to do the same thing. So checking their track records, making sure we know inside out before awarding any further grants.
Yeah. And that's a lot where Dr. Merlo's work will come in, helping us evaluating those the partners that we're currently working with, and how we're moving forward, making sure that they're meeting their KPIs and measurables that they list in the template and their applications and their proposals. And I don't know that we've specifically met, but I do want to say that this is for certainly helping the opioid epidemic in Metro Louisville, Jefferson County. So again, we're focused on those residents that have the least access, face the most barriers, and have been traditionally underserved in these areas. And yes, Deputy Mayor George.
Thank you. I would just say what I wonder is if another challenge could be alignment. and how you maximize impact. So we know that, these funds are also going to the state, not our funds, but opioid settlement funds are also going to the state. We know that we have philanthropic partners that are also interested in this space. And so I would imagine, and I don't know, others may feel differently, but I would imagine that there will be a challenge in how you align investments to maximize impact.
Agreed. That is one of our specific goals in moving forward, is to aligning with the state disbursements, and current infrastructure in the community, and so it's something we'll definitely be looking at and hopefully achieving.
And I guess my next question is, who can connect me with the partners? So maybe I could start getting to know some of the partners, some of the contracts that have been awarded, and so then I'm able to meet with them and possibly start seeing what is the type of data collection that they have, how is it that they're using their funds? Is there a point of contact in this, or is it this meeting, right? Anybody that maybe could help me?
Yeah, for now, I think Taylor will be the right person, but as soon as she's done interviewing those 13 candidates and we have a person assigned, so that will be your point person. But you can reach out to any of us, but Taylor can introduce you to all of those people.
And I would encourage everyone, and on this meeting, to review our website that we have devoted to the Opioid Settlement Advisory Board, and the distributions. Dr. Murillo, there's an internal drive that you can find all of the documentation. You should have that. We'll make sure that you do, that lists the proposals and the application, and the things that we've discussed today, with all of the attachments that the board members have received.
Any other questions or comments by anyone? So I think, in summary, I think, Dr. Maria, you have tons of work ahead of you while you meet these community partners and try to figure out what are they measuring, and then match that with what we should be measuring. As Deputy Mayor brought up, how do we measure, what are we getting for the money, the public money that we're spending? And then also, we need to spend some time making people aware, our partners aware, that we will be sending out this application process will start in the next 30 days, and they have access to the website. And our focus will be prevention and treatment, and sort of work with wraparound services around homeless people, treatment, recovery, so on and so forth. Dr. Lederman, any questions or comments?
No, I'm good. Thank you.
Okay, if you don't mind, just introduce yourself for a second. No one, we went around the room before you could join us.
Sure. So my name's Dr. Lederman. I work at Louisville Metro Department of Corrections. I'm on our administrative team, and I'm also a psychologist. So I kind of wear two hats in the jail. But I appreciate being part of this, and I think my role, or I guess perspective, to offer our team is from the psychology lens, and then obviously working with the population that comes into contact with the justice system.
So with that, I think if there are no questions or comments, I truly appreciate, Connie and I truly appreciate, on behalf of Metro Health, you all taking time to join this advisory board and helping us serve the community. So with that, we'll adjourn the meeting. Thank you, everyone.